All right, 5 minutes past the hour. Welcome to the show. This is Your World. My name is Winnie Lubabe, hoping and trusting that you have been keeping safe and warm, and especially here in Nairobi, can be a little bit chilly and a bit warm, but I hope that you're safe all together. Welcome to the show, and today we are exploring reconstructive surgery. And I know majority of the times when we talk about reconstructive surgery, the first thing that will always come to mind is either plastic or what we know as cosmetic surgery, all right? And of course, over the few years, we have seen a lot of conversations and a lot of debates, and especially on social media when it comes to reconstructive surgery. But what you don't know is this other side of reconstructive surgery that is very necessary and very important, and that is what we'll be exploring today, all right, on the show. So you want to stick around and learn much more on the same. But again, if you have any question, like we always say, in as much as this is our show, it's also your show, all right? So feel free to interact with us on our social media platforms at NTV Kenya, both on Facebook and on Twitter, and ask any question that you have as far as reconstructive surgery is concerned, so that by the end of the show, we demystify all the myths that are there as far as reconstructive surgery is, right? Breast and tummy tuck. And the name, abdominal plasty. Yes. Quite a mouthful. Thank you so much, Agatha, for also agreeing to come and speak with us. I know this can be like a very sensitive area for a lot of people, to talk about, but and that is because of the stigma that is there, because people don't really understand, the extent and of course the intensity when we're talking about reconstructive surgery. So thank you really for coming by today. And I will quote what you said, and this is when you sent me yesterday, and you said, "These two procedures have been great milestones towards giving me my desired way of life, because I am now able to engage in various activities and tasks that I was not able to previously." Very profound statement. And of course, we'll come back to really understand how this is the case. But Dr. Martin, let's just start with you. Because like I said, when we talk about reconstructive surgery, like the fact that we think about surgery, we usually think towards this other side, right? But when we talk about reconstructive surgery, what exactly are we talking about?
When you're talking about reconstructive surgery, it's a surgery that sorts out form and function.
Form and function. Okay, I'm going to write that down because I'd want us to explore more on the same. Form and function.
So I want to take it very slow. So plastic surgery is very broad.
Okay.
So you have reconstructive and you have cosmetic or aesthetics.
Okay.
So when you talk about aesthetic surgery, you're just dealing with form.
Okay.
It means whatever part that you are modifying doesn't, you can do without the surgery and it will be functional.
Okay.
But when you're doing reconstructive, it means the part that you are really changing or molding, the form is going to adjust and improve function.
Okay.
I hope that is the simple way I can put it.
Okay.
There's a crossover between cosmetic and reconstructive surgery, because when you're doing any surgery, plastic surgery, you have to talk about form, function, and cosmetic.
Okay.
Because whatever reconstructive part or part that you're going to do reconstruction, it does look good.
Okay.
So it means there has to be the techniques, or there has to be an outcome that is aesthetically pleasing.
Okay.
Yeah.
So the fact that we're using the term reconstructive, first of all, it's not like we are constructing from it used to be there. It's something that exists, so we're just
exactly, either it exists or in a normal way, or existed in a way that was not optimal.
Okay.
So you're trying to reorganize.
Okay.
Yeah. So for example, if you have a defect, either after incision of cancer or after having a road traffic accident, you've lost a tissue. So you want to bring back that tissue, either using tissue around it, meaning local tissues, or tissue from distant part, meaning distant tissues.
Okay. All right. And you also brought up something else, and that is plastic. And you mentioned plastic surgery, all right? And the reason why I'm really curious on that term is because majority of the times when we talk about plastic surgery, a lot of people equate that to cosmetic, right? So you've talked a little bit about cosmetic and reconstructive, and now plastic. All right. So can we just first of all understand the plastic aspect when we talk about surgery in this case? Yes.
So plastic is on top.
Okay.
If someone tells you they are a plastic surgeon, it means they do both cosmetic and aesthetic.
Okay.
Or you can have a plastic surgeon who just focuses on cosmetic, or focuses on reconstructive.
Okay.
So plastic is a big term. And plastic comes from the Greek word plastikos, which means to mold.
Okay.
So meaning our profession, we are in the business of molding body parts, and we work from head to toe.
Okay. All right.
So
I'm thinking about the plastic.
It doesn't mean that we
Plastic.
deal with plastic to reconstruct, but it's just from molding,
Yeah.
the word molding.
Okay.
They call plastic. So
okay.
plastic surgery.
All right, I hear that. Okay, but let's speak to Agatha. So Agatha, like we said, you underwent 2, right? But let's go all the way back to teenage years, right? Puberty, because you said this issue actually started then. You did not underwent or undergo reconstructive surgery then, but the issue started during puberty, right? So can we go all the way?
Yeah, I was a bit bigger than my peers when growing up.
Okay.
And when puberty
right.
set in. So, but now that was okay at that point. I was okay, I was fine with my body. But now when I got to the childbearing age and I started having babies. And of course, when a woman gets babies, the body naturally becomes bigger.
Changes, yeah.
Yeah, so my body never shrank back. My breast never shrank back into a normal size, and it continued. Like every time I get pregnant and I have a child, I would not go back. So they continue to be bigger.
Yeah.
And at some point now, it became a baggage. Like it was quite a big load for me. And I started exploring. Of course, I did not start with going to the doctor. I started with the pains and the discomfort associated with the extra weight. And eventually, there's a lot I couldn't do. Come to work, I couldn't sit for long. At some point, after maybe 1.5 to 2 hours, I had to take a break because I'd get extremely fatigued. If it's working on a computer, if I'm working on a computer, of course, I'm definitely bending, and I would get neck aches and back aches, and it was quite some pain.
Okay.
That at some point I needed to go for physiotherapy.
Okay.
At one time or the other.
All right.
Yeah.
Okay, I want us to still, because I'm still at the puberty stage.
Yeah.
Okay. And you see, at this age, it's a very difficult phase for anyone, if I can say that, because so many changes are happening. You're confused for the guys, the boys, and some people start growing beard and all those things. And then for the girls, the breast starts to grow, and the hips become a little bit rounder, and it's just a lot of things that are happening. So for your case, and I can remember, because even during our teenage years, you'd see a lot of people, a lot of girls would, sort of like slouch because they want to hide, all those things that are happening, especially for the breast, right? So I'm just curious for you. So at what age did your breasts develop, and how was it? How was the rate? Because again, like you said, you were bigger, and that was okay with you at that time, right? Yeah, but just on this specific area, that is your breast, that brought about a lot of issues that you also had to go through tummy tuck as well. I'm still let's talk about that. Paint that picture for us.
I think being bigger than your peers raises some questions.
True.
Within yourself. And of course it held me back a bit. I was a bit self-aware, self-conscious.
All right.
And I'll try to dress in bigger clothes until much later in life, of course, when I'm a bit older. And I realized it's like an asset.
Yeah.
And I started embracing myself. But now, for a period, of course, because now there's a time that I was okay with myself, now after the teenage years. Because during the teenage years, it was something not so nice having, everyone looking at you in a different way. Like you're attracting the unlikely attention that you don't want. But now, when in my 20s, now I became a bit more comfortable with it.
Okay.
It was not long-lived because now I became a mother after that.
All right.
And now that's where now the problem started setting.
Okay.
Yes.
Okay. And Dr. Ajuja, would you say this is like one of the biggest concerns for so many women? Because I've had a lot of women say, back pains. I'm really struggling with back pains because I think my breasts are fuller and heavier. So is this one of the major concerns that you see?
Yeah. Breast, what we call micromastia, excessive breast enlargement is one of the commonest problem in blacks.
Okay.
Let me say, Western world they do more of augmentation. They add silicone or fat.
Yeah.
For population, number one procedure in this country is breast reduction.
All right.
Which we're doing. And such condition come with two kind of pain: psychosocial pain and physical.
Physical pain, yeah.
The physical pain is the neck pain, back pain, shoulder pain. The psychosocial now is the stigma, the social embarrassment, the feeling that if you're a teenager that you're sexually active at a younger age, all that problem that comes with it.
Yeah.
And you can imagine someone carries that from the teenage, that trauma, this psychological trauma, and then even during the relationship and after childbearing, it becomes unbearable.
Yeah.
Because there are two growth spurts. Growth spurt around teenage, and then after pregnancy and breastfeeding.
Okay.
So and this for me is one of the most misunderstood issues that women are facing. And the more we talk about it, the better, so that it's well understood. Because some of my patients, when they come for reduction, they don't get that support from their partners.
Yeah.
Because they're told, like, you're okay, big breasts are good.
Yeah.
Why would you, when you touch your breast?
Yeah.
Whereas this lady is suffering from two kinds of pain.
Yeah, and even like day-to-day conversations, you'd hear some women say, "Oh, my breasts are bigger, and it's bringing me a lot of pain," and someone would be like, me, if I had bigger breasts, this is what." And I don't know if this is like
Exactly. I mean, there's always that other voice that comes from the other side.
You should be happy that
someone who is not experiencing that, or someone who has a
Yes.
lesser, a smaller bust, and they think you should be happy that you have a better. I mean. Yeah. And we see even after, and especially after childbirth, or even before, right? It's normal for these changes to happen. But Agatha mentioned that yours did not sort of like go back to quote unquote normal, or how they were before childbirth. So is this a common thing that you also see? And at the same time, I think this is the second part to that question, and that is then, so at what point does it become an issue that might require surgery to relieve a person of several issues, and including both physical and emotional pain as well?
So the size of breast, there's no ideal size of breast.
Okay.
It usually depends on your body posture. And normally the normal sequence is you have breast enlargement, and the normal pubertal growth after puberty, and then you have enlargement to accommodate breastfeeding.
Okay.
But that breast is supposed to involute, meaning it's supposed to go back
Okay.
to pre-pregnancy state. However, when this enlargement causes pain, especially physical pain, then that is an indication for intervention, in this case surgery.
Okay. All right. So do you then determine that as a surgeon? Because it varies from person to person. There's some people who might be just be uncomfortable with the fact that it is bigger, it is fuller, but there's some people who might experience pain, and this is both, like we said, physical and psychosocial. Yes. So do you determine that which cause of?
Now that's a typical distinction between cosmetic and reconstructive.
Yes.
Because now when you're having pain, it becomes, there's a medical indication for that.
Okay.
But when you just feel your breast is big, you don't like, that now becomes cosmetic.
A totally different conversation.
Yes,
Yeah.
that's not cosmetic.
Okay.
And that is where now you have a distinction. Even for the third party payers, insurance or whatnot, that is where they'll have the distinction.
Okay.
So when you have physical pain with an enlarged breast, then it becomes a reconstructive surgery. However, when there's no pain, it's just a desire to have better looking, firmer breast, then that is
Okay. Agatha, take us through your experience. So you mentioned pain, back pain, neck, did you say? Neck pains? And you also mentioned migraines as well. Can we just get to understand more about that, and especially for the migraines, and just paint that picture for us, because a lot of the times it's very difficult for people to understand when you tell them, listen, I am in pain because this is what is happening.
I think it's because of the tension,
Yeah.
and depending on what you're doing at a particular time.
Okay.
So whatever activity you're doing, or whatever task, and the tension that is associated with the weight being on a certain side of the body.
Okay.
So, for instance, I was telling you, if I'm working on a machine, on my laptop or my computer for quite some time, I'll be bent.
Okay.
And so the pain will come from behind here, and eventually it becomes an explosive headache. So I always needed to know when to stop, so that it doesn't go beyond now the normal fatigue into something bigger, like the migraines. Okay. But it took a while before I realized that the migraines were coming as a result of the weight. Yeah.
Okay.
Yeah.
All right. Any other thing? Because you said you were not able to do a lot of things
yes,
in your day-to-day.
I think the most disturbing thing for me was being unable to do house chores.
Okay.
Because previously I had been diagnosed, I'd been told I have a problem with nerves on this side, on the right arm.
Okay.
And whenever I did any chores, the arm would hurt. Very, very, very much so that I had to get some support. And with the procedure, all those pains are now gone.
Okay.
Yeah.
All right.
Yeah.
We'll come to the procedure, because I'm trying to imagine. So your baby, of course, they're still young. They need your attention, but now you're also in pain. You're not able to. You're smiling. What happened?
that was the most difficult part of healing, because then my younger child was quite young. He was 3 years, and of course he needs to run to me. And you can imagine now trying to run away from your child, because picking is he's a bit heavy. Yeah. So now I knew if I pick him up, I'm messing with the process of recovery. So it was quite a tricky situation at that point. But we came to adjust.
Okay.
Yeah.
All right. Dr. So then what usually happens, because we talked about who qualifies, who's a good candidate, first of all, to undergo the surgery, and that clear distinction between cosmetic, and this other side, right? So the big question might be, so if someone comes to you and says, listen, I'm experiencing, back pains, this and that, right? So then what usually happens? Is surgery the only option? Or what usually happens before you conclude that this person is a good candidate for surgery? Yeah.
So let me just turn it a bit, pick from where she left. Most of the patients are usually referred to us by other specialists, orthopedic surgeon, a physician, a neurosurgeon, because they've done all their workups, they've done scans, scans of the spine. They could not find anything. The nerve conduction studies, there's nothing that in fact, some of them even come with shoulder dislocation because of excessive large breast.
Yeah.
When such a patient comes before you, you have to screen.
All right.
So you look for large breast,
then
physical pain, the neck pain, back pain, and shoulder pain, and then the psychosocial pain, limitation of physical activity, like what she's described.
Okay.
Climbing stairs, doing normal activity of daily living. And then there's another important point of difficulty in finding fitting tops and bras. It's usually a nightmare.
Yeah. Yeah.
And that also worsens now this self-image. Self-image. So you don't feel nice. Whatever you wear, you just feel like it's off.
Yeah.
Once we've done that, then we examine. When you're doing physical examination, it becomes obvious. You find excessively large breasts that have taken almost the entire trunk.
Okay.
That to the umbilical level or all the way to the waistline. And then you find there are grooves on the shoulders because of the bra straps, the bra supporting the heavy breast.
Yeah.
Then you have changes, skin changes below the breast, either rashes, ulcerations, or darkening, what you call the hyperpigmentation.
Okay.
All that points to somebody who's really suffering from excessive large breast. The only way to get out of that is surgery.
Okay.
This is the explanation. They already have enlarged breast component. Breast has skin, the gland, and fat. All the three components have to be enlarged. There's no medication that you can give to reduce the gland, fat, the skin. You have to do excision.
Yeah. Some people talk about exercises. There's some exercises that you can do that can reduce, but no.
No.
Okay.
Yes.
All right.
Already you have enlarged your skin, enlarged your gland, the nipple has moved downwards. There's no way you can exercise to bring that back.
Yeah.
Remember, when you're doing exercise, it affects your muscles.
True.
Breast tissues are not on the muscle; they are on top of your muscle.
Yeah. Okay. So surgery is usually
It's the gold
the.
standard.
All right. Okay. And aside from that, we also have other conditions that might also necessitate for a reconstructive surgery. It's just that now we're referring to
Yes.
Agatha's case.
Yes.
And this is on breast reduction and tummy tuck, which we'll talk about after the break. But very quickly, on some of these other sort of like conditions, instances, scenarios that might also, one might need reconstructive surgery. Very quickly.
Quickly, head to toe. So from head, you have scalp defect, either from accident, from cancer. You have any facial defect, eyelid, the nose, the lips, accident, cleft lip. Those are all reconstructive surgery. Chest wall, breast reconstruction after mastectomy because of cancer.
Yeah.
You have any defects on your chest wall, either congenital, that means you're born with, or after trauma. Going down on the tummy, we're going to discuss
Yeah.
the defect from the abdominal wall, either from herniation, separation of tissues, from trauma, from accident.
Okay.
And then along the pelvic area, the same thing, all the way from reconstruction of the genital area, and then around the thighs, commonly in this country on the legs because of borders and traffic accidents. So you have tissue, loss of tissue, soft tissue covering of the bone. Someone involved in an accident, they get a fracture, their bone is exposed. So you have to do reconstruction, which is a very, very common thing that you do as plastic surgeons.
Okay. All right. So let's take that break. But of course, Agatha, will come back to you because, again, like we said, you did not just go through one, right? But you went through the second one, and that is on the tummy tuck. And again, and especially now with the craze as far as social media is concerned, you mentioned tummy tuck, and people would. The first thing that you think about is, oh, you want to look good. But no, there's some serious conditions that necessitate that. And of course, Agatha, you'll tell us, your journey with the same. And also, is there such thing as not an ideal candidate for reconstructive surgery? So that we just put everything clear right here on the show. But again, if you have any question for Dr. Ajujo, feel free to also engage with us. And if you also have a question for Agatha, feel free. Our numbers are down at the bottom of your screen, or engage with us on our social media platforms. So much to discuss on the other side of the break. So you want to stay with us. All right, welcome back. Glad you're still with us. The show is Your World. And of course, today we are exploring the world of reconstructive surgery. And of course, also demystifying all the myths that are there as far as reconstructive surgery is concerned. Because like we said, when you mentioned that term, the first thing that comes to many people's minds is on this other side of cosmetic surgery, which again, we're having this conversation during the break. And Dr. you were saying, you see general well-being, not health, you think?
Health is not just
Health
physical.
is not just physical.
It's also mental.
Okay.
Yeah.
All right. Okay. I hear that. I completely hear you on the same. But before that, Agatha, like we said, you went through two, right? Surgeries. But we have some photos, and I'm sure you've seen the photos during the conversation. But I want you to take us through those photos, right? And especially the before. What was happening? So there we are. You are the one on the right?
Yes.
Pink.
Yes.
The one in pink.
Yes.
If we can pause, that one and just and other one. I want you to take us through what was happening there, so that people then understand why you needed to go through tummy tuck,
Okay.
right?
Yeah.
Yes. Take us through that. Can we go back to the first photo, Jack? So if that's possible. Yes, that one. If we can pause on there and just take us through. This Agatha.
Yeah, so I at one point, one of my pregnancies was a complicated pregnancy.
Okay.
And after delivery, previously I've always been a person who is physically active. And when I gave birth, the stomach still did not shrink.
Yeah.
Of course, I noticed immediately, like, this is not going away. And I thought it can be fixed through exercises.
Yeah.
I didn't exactly think there's a fix to that. So, I mean, we always see women with, after delivery, we have these big tummies. So, for me, I thought I was in that cluster of the women who are going to end up with big tummies. But, of course, working out, it never worked. And instead of actually working out, like losing weight, the weight would go a bit slowly. But then the tummy would will
So like remain
yeah,
intact
will
or
go down.
Oh,
Actually,
it's
it was
okay.
yeah.
All right, it would sag, you would say.
Yeah, it
Yeah.
was sag.
Yeah.
It really bothered me, but I did not think there's a fix to it. And one of the days I was going for an after review with Daktari, and he's the one who noticed and asked me to go for a checkup. And it turned out I had a hernia. I think that had occurred from the pregnancy.
Oh wow!
And we had to go through the surgery with Daktari, and yeah, and being that he's an artist.
Okay.
Yeah. After repairing the abdominal wall, I mean, he couldn't leave me like that.
Yeah.
So of course he looked at what he can adjust here and there.
Okay.
And I ended up looking better.
Okay.
Yeah.
All right. Can we move on to the second photo so that you'll tell us? So the first Agatha.
Yeah.
And then the second Agatha.
Yeah.
How much of a difference? And not just physical.
Yeah.
Because the doctor said health is not just physical,
Yeah.
right? It's also mental, right? So after that, so when was this?
This was early.
Okay.
early this
All
year.
right. Way after both surgeries.
Yes.
And we can see a totally different person. So this was before surgery.
Yes, that was before surgery.
This is before surgery.
Yeah.
And of course we can clearly see from those photos huge difference. But for you, so how long after the breast reduction surgery did you go through?
Exactly 1 year and 2 months.
Exactly 1 year and 2 months after
Yeah.
after that happened. Okay, so what would you say was like the biggest change aside from the physical that we can all see? Right?
I think
how much of a difference was
I think it gave me the reality that even what you think is impossible is also possible.
Okay.
And I started appreciating myself. The kind of self-love I had went a notch higher.
Oh, nice.
Yeah,
Okay.
and I will say my self-love went a bit higher, and I'm more confident with what I'm doing now because, I mean, I always expect some good results. I'm also able to do a lot of stuff. I play with my children. I am endlessly out here. You can see in one of the photos, I'm out on a hike.
Yes.
I'm always out doing something. I have busting energy right now. And of course, psychologically, I feel I'm at a very good place psychologically because previously, of course, even when you wake up and you're trying to dress and there's nothing in your wardrobe that is fitting or looks good on you, and now I just wake up and dress, and interestingly I still feel good, that I look good.
Yeah.
Almost
no,
every
you do
outfit.
look good.
Thank you.
You do look good. Okay. And again, we were having this conversation during the break, and we said majority of the times the stigma that comes with, this whole aspect is what sort of like is one of the biggest impediments to people seeking health, because again, like we said, there's a very thin line between the cosmetic aspect of the same and the reconstruction, right, side of the same. And I would want to hear this from you because, like you said, a bigger change was noticed after you did the tummy tuck, right? And a lot of people are like, okay, who is this person, right?
Exactly.
So I would want to hear from you on that side. Was it more of sort of like stigma, like, but see, you were just like this way the other day, what happened, that we see a totally different person? Or was it from a point of concern and care, and they're like, we're happy because of how you feel now? Because like you said, you're able to do a lot of things, and one of the things is play with your kids, which you're not able to do previously. But Daktari as well, do you want to just take us through the tummy tuck whole aspect of the same? Who's a candidate? Because like we said, is there such thing as not an ideal candidate for reconstructive surgery?
I'd say any surgery in general.
Okay.
Because when you go through surgery, there are risks.
Yeah.
So how do you mitigate risks? Is by having an ideal candidate.
Okay.
An ideal candidate, one, you don't have comorbidities. Means if you're hypertensive, you're well controlled.
Okay.
You don't have heart issues. You don't have kidney issues. And if you do, you are cleared by a physician. There's no history of clots, or you're not immunosuppressed, meaning your immunity is intact. Because there's that risk of anesthesia and the risk of surgery and infection and recovery. So for you to pick any surgery, you must go through a consultation. And I usually advise somebody to go more than one consultation.
Okay.
You are screened, and after that you're going to do a bit of lab tests, sometimes imaging. For our case, we had to do a scan just to confirm what was happening with the tummy. And that is where we noted the hernia.
Okay.
So you cannot just, most people cannot just maybe make a call now on NTV and say, oh, I want tummy tuck.
Yeah.
And then tomorrow I book you for surgery.
Like, yes. You have to go through
a screening mechanism.
Screening.
Yes.
Yeah.
So that we make sure it's safe. And more importantly, that surgery is going to be beneficial to you.
Okay.
And the discussion you're having is that you're going to adhere to the post-operative instruction, which is very, very important.
Okay.
Yeah.
All right. And we'll come back to that because again, like you said, it's not like a one-time thing and that's it, all your problems solved. No, you have to, adhere to certain, diets, lifestyle, if I can say, so that you are healthy at the end of the day.
Exactly.
But even before that, so what is that thing that people really need to understand? Because like we said, number one, awareness. People need to really be aware as far as reconstructive surgery, is concerned. But even on the whole aspect about health, and you talked about some of the risks or complicated that, might come about. Can we just start with that? What are some of the foreseeable, risks or complications that people really need to be aware about? Yeah.
The common ones are accumulation of fluids, because when you're removing tissue, there's dead space.
Okay.
So you can either have accumulation of what you call seroma, which is normal fluid accumulation. With time, we're able to get rid of it.
Okay.
Or sometimes you can have blood clot accumulation. Those are the common ones. And then you can have infections around the incision, mild to severe ones.
Okay.
And what we dread most is now clots. What we call DVT or pulmonary embolism with such procedures.
Yeah.
So you must be aware, and you
Okay.
must be. We score you when you do come. We score you, and then we're able to mitigate. Either give you what we call prophylaxis, blood thinners to prevent you having clotting, or having mechanical measures to prevent clot formation.
Okay.
Yeah.
All right.
So it's very individualized. My point is these procedures are very individualized, and everyone has their own journey. Your journey, my journey is
It's totally different.
Totally different.
Yeah. Okay. And Agatha, again, we were talking about this, and you said you sought, other options before going for surgery, right? Do you want to take us through, what happened? What are some of the things that you tried? You said you tried exercising, but again, did not work much for you.
Not work. I've seen various medical practitioners because of the different symptoms that were presenting, and I used to go for like two physiotherapy sessions.
Okay.
In a year.
All right.
Because of the persistent backaches. And actually, before I went for the tummy tuck, I was in the middle of a physiotherapy session.
Okay.
But I've never gone back.
Since then.
Because all those issues went away.
Okay.
Yeah. So
All
there was a lot of things I used to try to see, because at the end of the day, I mean, surgery is not the best for anyone to opt for. So, but eventually, it was the only thing that could sort me out.
Yeah.
Yeah.
Okay.
Yeah.
And when after both surgeries, again, like we said, a lot of people, of course, would notice. I mean, we saw the photos clearly. There's a very huge difference. And it's good to hear you say, listen, I actually think you said, I think I look good, but no, you actually look good, right? Yeah. So what was the first thing that came to mind? But even from the external, right? People looking at you and thinking, hiya, okay, what happened?
Okay, I think I was not aware. I was not expecting that the change is going to be immediate.
Ah, okay.
And even when you see yourself in a mirror, you don't really imagine that there's much change that can be noted. Yeah. But now when it came from, including that Tari here, I think the first day he saw me, he was shocked.
Yeah.
So I think now that's when I realized there's something positive. Yeah, there's something good that has happened as a result. Yeah. I've not had a lot of stigma. I mean, I openly tell people it's a surgery, and it was a needed surgery. I don't really hide.
Yeah.
Because there could be someone you might know someone out there who may be in need of the same. So, I mean, we'd like to help one another at the end of the day.
True. Yeah. All right. And like you said, of course, after the surgery, it does not sort all your issues, right? Certain lifestyle, diet and all those things. So do you want to take us through how that has been for you and how you're able to maintain, the same?
Okay. I think for me, it came as I had to do it. I had to change my diet because even before I went for the surgery, we had a concern with Dr. because I'm diabetic. So after the surgery, I really had to make sure that I have adjusted my diet. Interestingly, with the change of diet, I lost quite some weight.
Oh, okay.
Yeah, and putting in exercises. I started with walking, enrolling in the gym, hiking activities. I'm doing a lot as a person to make sure that I'm at a better place.
Okay.
Yeah.
All right.
Yeah.
And Dr. do you want to take us through how necessary this is? Because we've seen a lot of people who have gone through reconstructive surgery, but then after a while, it's like nothing happened, So can you talk about how important this is and what are the risks if you do not sort of like maintain certain lifestyle, and that's, in this case, we're talking about a healthy lifestyle, to help you on your day-to-day.
This applies for both cosmetic reconstructive surgery. Aftercare is very important, and aftercare begins from that morning after surgery.
All right.
So the first 1 week, we're going to help you. We're going to be there for you in terms of the nursing team and the medical team. It means we're going to make sure the food you're giving you is the right one.
Okay.
Take care of your wounds. Make sure they heal very well. Make sure you are up and about, you're active, and we sometimes even do massages just to help you let the edema, the swelling go down.
Okay.
But after that, once you're healed, it's now upon you.
True.
We'll give you some body shapers compression garment, which you have to wear for about 6 weeks.
Oh, wow. Okay.
And after that, you might even have to extend for another 6 weeks, depending on your recovery.
All right.
You have to make sure you watch what you eat, because I usually say a fat cell can be at this small or this big.
Yeah.
Yeah, and it's impossible for us to get rid of all the fat cells in your body. So if you increase your intake, that it means you're going to have more fat being stored in the wrong places. Physical activity, your diet, and just really, this surgery is supposed to kickstart your life, giving you a new lease of life, of which now is your responsibility.
Okay.
Yes.
All right. And a lot of people will be curious to understand. So the healing process journey, it's different for different people, right?
Yes.
But relatively,
Okay.
how long does it take?
Downtime.
Yeah.
That's usually they come to ask me. So these procedures, let me say, if it's a breast reduction, it takes in theater takes about 2 to 3 hours.
Okay.
And then admission takes 2 to 3 days, and then follow up up to 2 weeks. The first week is hectic. He'll tell you that.
Yeah.
But from the second week, you're back on your feet. If you are to get time off work, take between 2 and 3 weeks. Full recovery for you to go back to the gym is after 3 months to 6 months, depending on the extent of the procedures. Yeah.
Okay.
Yeah.
All right. And of course, Agatha, you had to go through all this. Just to make sure that that you are okay.
Yeah.
All right. So I know a lot of people, and of course, since again we're sort of like basing our conversation today on your surgeries, there's a lot of women who, number one, are scared, don't know how this procedure will come out, right? Because the intention is to relieve you of your pain, both physical and, like you said, psychosocial, right? So a lot of women might be scared, be like, okay, so I don't know who to talk to, what are my options, and all those things. You went through the procedure, that is breast reduction. Let's just start with that. So what is it that you would say, and especially when we're talking about demystifying the myths, because a lot of people have a lot of things to say, and majority of them are not true.
I think, including me, of course, I thought what will people say? I mean, because having a big change on your body parts will definitely raise questions.
Yeah.
But I think your health, your normacy comes first.
Okay.
If you're not able to perform your duties, you're not able to do regular tasks, I think then you need to go out and look for these services.
Yeah.
I hope by what Daktari and his cadre are doing by demystifying plastic and reconstructive surgery will reach out to more people out there. Because I think there's that stigma, as you're saying, because anytime you have a change in your body part, it's viewed like you're being vain.
Yeah.
Yeah, but it's something that you might need at the end of the day. Yeah, it's something that one might need. And yeah, go for it.
Okay.
Yeah.
All right. And Daktari, because we've also seen, I think there's a case of a teenager who had gigantomastia, and sometimes we struggle with what's normal and what's not. And I think it's just the way we are socialized, where people would say, yeah, but you're a woman, this is how things are, right? So with that in mind, and just understanding some of the things that might predispose someone to developing such conditions, including gigantomastia, what is it that you would say so that people are aware and know when to seek help, and not just, sit and say, listen, this is normal. We're women, for example, or we're Africans, or this is how we are. Understanding that aspect of what's normal and what's not. Yeah.
So first, for example, if I'm to speak about breast, there are two growth spurts. So two patterns. There's pattern that occur around puberty.
Yeah.
This pattern occurs that after breastfeeding.
Yes.
Yeah. So we have young girls, if I may call them, who have excessively enlarged breast and they have symptoms.
Yeah.
And for them, their psychosocial symptoms are even more.
True.
They need help. So if you see a young girl who has excessively enlarged breast, like I have two cases of, I think there's a small girl from Siaya, another from Budalangi, where I removed 10 kilograms of chest.
Wow.
So that is not a normal child.
Yeah.
It's not a normal child. They could not. They had dropped out of school. Both of them. One of them had ulcers on the breast with wounds. So it doesn't have to reach there.
Yeah.
By the time someone has maybe 3-4 kgs on their chest, so they need to seek medical attention.
Yeah.
And there's nothing African about having
this,
excessive enlarged breast. And we should not stigmatized. We should not think that having intervention for breast surgery, it's vain.
Yeah.
It's like any other growth. If you have a growth on your knee, you have a growth on your thigh, on your arm, you'd go for intervention.
Easily go, yes.
Yes.
Yeah.
So this is just like any other growth that really needs care and attention.
Okay.
Yeah.
All right. And even aside from that, like we said, there's so many other conditions that might necessitate for reconstructive surgery.
Yes.
I think that goes, and it goes a lot to say as far as our health-seeking behavior is concerned. We wait until sometimes something becomes worse before we seek help. So I think being aware of, first of all, what is happening and then seeking help. Okay. All right. Can you talk about... Okay.
In other jurisdictions, other surgeons have really done a lot of advocacy, so insurance are aware that this is a medical condition that needs coverage. In our country, we're still trying. I can say they are good. They are insurance which understand, especially if it's a case that is justifiable, they do cover.
Okay.
So there's no blanket coverage for this, let me say, breast surgery.
Okay.
But all other reconstructive surgeries are covered by insurance.
Okay.
Yeah.
All right.
Yeah, because we're not just doing change of form, but you are actually improving function.
Yes.
And
Talk about those two when you
Yes.
started the show. Form and function. That we get. Okay.
Yes.
All right.
So reconstructive surgery are covered by insurance. And I told there's a thin line, so you really have to be sure it is a reconstructive surgery, not a cosmetic surgery, and be honest and open about it.
Okay.
Yeah.
All right. Okay. Did you have to do like an out-of-pocket, maybe health insurance cover? Was it difficult? Was it easy for you to get that? Because like Jerry says, it really has to sort of like make sense, especially to the third parties as well. And I wonder if this is a gap that maybe, sort of like needs to be closed as soon as possible.
It is a huge gap. It is a huge gap because in fact, the people on the other side don't understand. If I'm a plastic surgeon and I've done a request to insurance, the first answer is no. Yeah. Because it's always no until otherwise.
Yes.
Because I'm a plastic surgeon. Okay. And I think such forum is very important because you're able to let people understand that as a plastic surgeon, I don't just deal with cosmetic, but I also do reconstructive surgery.
Absolutely.
Yes.
All right. Agatha, what would you say towards the same as well?
Yeah, I think it's a very tough space for us women because you see, as the doctor says, it's a growth like any other, and any other growth is covered if you have any other growth. And I don't know where the breasts are just left out. I did it out of my pockets. Yeah, because my insurance wouldn't cover that. But for the abdominoplasty, it was there. There was no question.
You have to prove that this is.
There was no need to prove. But for the breast, I really tried to push. It won't happen. So I think it's something that needs to be done. Because as Dr. says, there are very many women. If you follow Dr.'s social media and other doctors and other platforms that advocate for breast reduction, there are very many people who say my day will come. I'll get that money. I hope one day I'll get the money. The pain is there with the women. It's only that the accessibility, because of the finances, it's not there. And if this can be done even to the public hospitals all around, I think that would be good enough, because now Daktari will be able to reach out to people out there.
That's true.
Yeah.
That's true. Okay. All right. So clearly, a very big issue over there that really needs to be sorted as soon as possible. And I know there's so many people who maybe have gone through, because again, like you said, cases of trauma, accident or diseases, and in this case, since we're sort of like focusing a little bit on breast reduction due to cancers as well, some people will just, and especially after mastectomy, people will just choose to stay there like that rather, because again, like we said, the cost is too high, they cannot afford, or sometimes there's a lot of still, stigma associated with the same. So what you're saying is there is help,
yes,
but a lot needs to be done.
Advocacy.
Okay, all right. So as we bring it to a close, so roughly, because I know it's on a case-to-case basis, and I know this is like a very big thing for a lot of women. They would want to know. So I don't know how. Are you okay to say maybe how much you spent on this? Because we really need to understand the magnitude or the intensity when we're talking about the cost aspect.
That was 2 years ago.
Okay.
Of course, things have changed now. I spent close to 350,000.
Yes, that's very costly for a lot of people. And again, like you said, this is on a case-to-case basis. So others might be more, expensive.
Yes.
And again, we really need to see something done on the same. Okay, so then as we bring this to a close, because Jax is like, yeah, you need to get out. Your time is up. So Agatha, what is it that you'd say, maybe to the people who are watching us, as far as reconstructive surgery is concerned, having gone through the same, and not just one, but two, and maybe the government, people who are watching insurance.
Yes.
Yeah.
To the people who are watching, especially insurance.
Yeah.
I think there's a lot to be done. Yeah. Insurance stakeholders, they need to do something about women, because this is an issue about women. And I'm sending it out to the women out there who have the voice and who are representing women. Do something about it, because it's a big issue.
Yeah.
And when you're not able to do your normal chores. A woman in the village cannot feed her cattle because she cannot carry a load that she normally would do comfortably. I mean, you see, it's more of a disability. It becomes a disability. So it needs to be handled like that. For the person who is out there watching and they would like to to have this change.
Yeah. Or even wondering if there is help.
There
you know,
is.
in the first place.
This, I mean, initially we never knew that plastic surgery was available in Kenya.
Yeah.
We only used to hear that people have gone outside the country. I think it's available and fairly affordable. I will say so.
Okay.
I don't think it's something that people have to go out there. And I mean, Daktari and his people who are like him, they are fairly, they're quite good at what they are doing.
Yeah.
So there's no need to go out there.
I hear that.
Yeah.
I hear that. All right, Dr. Very quickly, because we need to end the conversation. And then someone, this is some agago on Facebook asked, but why plastic? Very quickly as we end the conversation.
Plastic surgery encompasses cosmetic and reconstructive surgery.
Yeah.
And the reason why it's called plastic is from the founders,
Yes.
from Greek word plastikos.
Okay.
Because our work is molding.
Yeah.
We mold things into shape. Into the size and shape and form they're supposed to be. That's how we are plastic surgeon.
Okay.
And we are not limited by anatomy, meaning any part of the body. We're not limited by age. So we operate on children, adults, on gender, male, female, and on any body parts. That's why someone coined the term plastic. So we are fluid.
Okay.
Yeah.
All right. So thank you so much, Dr. Martina Jujo, plastic and reconstructive surgeon, as well as Agatha Mwangi, reconstructive surgery beneficiary. Thank you so much, both of you, for coming by today and enlightening us. I think I will leave this studio with the form in fact, aspect of the same, so that makes it easier for everybody to understand. But listen, like we said, if you are struggling, and especially for the women, there's a lot of things, again, that we talked about. Maybe you can refer to the show later on if you missed it. That is, if you're seeking help and you're wondering, okay, so is there help for me? Clearly, help is there. So do not suffer in silence. It is possible for you to regain your life, like Agathas said, and be happy. And most importantly, you're able to do your day-to-day activities. But until next time, see you tomorrow. Same time, same place, right here on Your World. But until then, stay safe and God bless. My name is Winnie Lubembe. See you tomorrow.